Hailing from the Jersey Shore and raised as athletes, the Airey Bros have always shared a passion for physical culture, athletic performance, and human optimization, always striving to be the strongest versions of themselves, mentally, physically, spiritually, and emotionally. Along the way, they've met some pretty amazing humans and have had some pretty epic adventures. The intention of Airey Bros Radio is to showcase these amazing people and the impact that they've had on them, and to share tips, tricks, and hacks so that you can win each day, every day.
You're listening to Airey Bros Radio. Be there or be square, because it's all killer, no filler.
First and foremost, we should thank you for your 12-minute foundation video, because that has changed our lives and kept us in that pain-free zone. And it's one of those things, you know, when you're messing up, when you're getting that lower back. And man, Rich, my lower back's hurting. Have you done your foundation today? No, that's the problem. So first and foremost, thank you so much for that, because that has got us out of a lot of binds.
My pleasure. You're welcome. Glad you guys are using it. I like that people are using the work. That's really cool.
Yeah, we love it, and it's been quite a long time. I can't even remember how I stumbled upon it and came across it, but I guess we've heard you talk about it before. But for our guests and listeners, if you could just kind of fill us in on your background and kind of how you came to design, the foundation training and all that work that surrounds that.
Yeah, man, I think at this stage, foundation training designed me a lot more over the past decade and a half. So it's like a rumination. It's, something that you just repeat all the time. And that's how this work was developed. That's how I came to it. I really wanted to figure out my own pain mechanisms that were causing me injuries as like a older teenager into my young 20s. I became a chiropractor, and along the process of becoming a chiropractor, I just beat my back up. It was so bad. When it would go out for like weeks, and it just hurt. Disc bulges and degenerative disc, not disease. That's the wrong phrase. It's a syndrome. It's a dysfunction. It's a mechanical breakdown that creates rigidity around the spine. And I had a lot of that at a young age. But I was very athletic, pretty strong guy. And I was really determined not to be out of commission for the rest of my life by age 26, 27. I was meant to get a fusion surgery. Not meant to. That's an inaccurate phrase. I was given the option of a fusion surgery at my lower spine at 27. And that was kind of the pinnacle switch point where I started exploring the ranges of motion of my lower back, and not towards like enhanced flexibility, quite the other way, more towards enhanced stability and cooperative motion is what it became ultimately, of the lower back cooperating with the hamstrings, with the posterior chain, with the back side of the body, keeping the length needed for the spine and for the front side of the body to kind of move well. And you can literally see like a linear progression and evolution of foundation training from the earliest videos, the earliest of which is that 12-minute video, and one or two others that I put on YouTube in 2011. So, 11 years ago, almost 10 and a half years ago. With those, you see a linear posterior chain activation technique, a handful of exercises that really create the need for endurance at the posterior chain muscles. What it's become over time, over the past 11 years, is a chronic pain management regimen. And with that, we have really created a breathing protocol called Decompression Breathing that expands the surface area of the torso, allowing muscles to sort of create a tone as they are pulled away from center, instead of always being asked to shorten towards center. When you do that around the rib cage and you learn decompression breathing, it offers a very unique type of strength to people. And you get a better posture. You kind of hold yourself up a little taller. Your breath volume tends to get a little bit better overall. We have shown studies that you can increase lung volume with it and different things. And there's a lot of nice pieces of health that come with that. So my story is literally the development of foundation training at this stage. Now, I'm a chiropractor by education, but I don't practice chiropractic at all. I have a very basic life, and I just really enjoy foundation training and teaching foundation training. And we've now taught over 1,200 instructors. So there's over 1,200 foundation training instructors around the world. We have 3 books out on the subject. We have a streaming website where you can learn every workout I've ever taught and the rest of my team has taught. There's over 600 routines over there. And we add to that weekly with myself and our core education team. And that's kind of the summary of what I do and how I came to it. It was a very long process that's still ongoing.
Now, with your back issues as a teenager in your early 20s, was that the onus for you to going into chiropractic, or?
Yeah, I think so. My uncle was a chiropractor. My uncle's very kind of mentorish to me. He's a guy I've always looked up to. He's really cool, really good chiropractor, really good surfer, good athlete. So I always saw a very healthy side with chiropractic. I never resonated 100% with like the adjustment and this is how you have to stay aligned and this will work forever if you do it. But I really loved the education of becoming a chiropractor. So I think that while I was in college thinking of becoming a doctor, I really fell into the more manual, biomechanical, anatomical based practice of chiropractic. That just made more sense to me. And I didn't want to go to pharmacy school. I didn't want to go learn the pharmacopoeia of medicines and how that chemistry can potentially react in the human body. And then that's like your gift is prescribing the right chemistry. That didn't make sense to me. So instead, yeah, I think that having my own injuries, my uncle was a very talented human that also happened to be a chiropractor to some pretty cool people and still is. And I remember being in medical school. I'm sorry, not in medical school, in pre-med. And I remember you could really see who was going to become a physical therapist, who might become a chiropractor, who might become a medical doctor or a DO. Then you could tell like who was going to become like a dermatologist or something, or like a plastic surgeon. And there was just like this delineation of not better or worse, just totally different drivers, totally different types of things you were doing and things you were studying and lifestyles you were looking for. And chiropractic really resonated with me very, very quickly.
You mentioned that the foundation training is a daily thing, right? It's not this quick fix, do it once and everything's good. It's a daily process to feeling good. How do we, because Rich and I suggested to people all the time, we send the video and then they send us back, I hate you, don't ever talk to me again. Why would you do that to me? They don't really want to go through the pain. They rather, get a surgery or take that pill. How do we start talking to people and approaching them with the, hey, if you do this every day, this is going to help you? And also, I know with all that comes in your daily life, being able to get your shoulders back and do that decompression breathing. Do you have any cues for that too in people's daily life? Maybe as a place to start?
There's not really, there's not a shortcut. That's what I've learned in our work. And honestly, in legitimate long-term pain relief, because you got to realize most people that come to us for relief are, I would say, 30 plus years old. And most of them have 10 plus years of debilitating injuries or problems. That's where our work has the best reputation, is in the very significant chronic pain. So our best reputation is in that kind of significant chronic pain realm. Because of that, we have to have something that is very accessible. The best way for this work to kind of imbibe itself and get really absorbed into your neurology and into your system is 10, 20, 30 minutes a day, every single day. And it's not the most intense 20 to 30 minutes or 10 minutes. It's a focused, deliberate, paying attention to what you're feeling internally and how that weak spot feels or felt and how it's starting to feel. And you're really looking for weaknesses and hindrances. And your goal in our work is to meet those hindrances every single day until you don't break through them. You guide them to a much healthier integration with muscles that surround them so that the joints that were hindered feel supported. And that is an everyday practice. And it's not hours and hours and hours every day, unless you become like where I am, where the team is, where you kind of do it all the time. whether you're teaching somebody how to do it, showing somebody how to do it, or literally like you reach for something and you're like, this is ridiculous. Like it just kind of bleeds into your ranges of motion in an almost obnoxious OCD way. So you can do too much of this too. But 10, 20 minutes a day is an ideal. If you're a really gung-ho athlete, try 25, 30 minutes a day. We have all the workouts you need. You can use our free YouTube stuff if you want, and then you can go to our streaming app and you can see the hardest stuff you've done. Like it will be very, very difficult for you to do 20 minutes of foundation training a day if you're really doing it well. So that's why I typically recommend like 10 to 20. Yeah, it's a neural pattern, man. You have to do it over and over again. There are no shortcuts. You should want to feel strong and healthy. And there's just no other way to get there than repetition.
And saying that most of the people that find the work are in their 30s, that's usually when life catches up to you and your back starts hurting. Do you think people can get away with training these neural pathways and not necessarily doing the weight training? Do you think once you get to a certain point, you're good doing this kind of yoga type, calisthenic type isometric holds? Is that enough?
Ask any other animal on earth other than a human being.
Touche.
other than the ones that swim, in which case even less resistance is enough to stay very strong. So yeah, I believe it depends on your goals. Can you become a bodybuilder with calisthenics? No. You can have a very attractive body, male or female. You can be very aesthetically strong and very, very functionally powerful with just body weight work. If all you do is like lengthening stretches like yoga, or tightening stretches like Pilates, or postural stretches like foundation training, your body will lean towards that thing. But strength is a term that defines many situations for many people. And if you want to be stronger than you can be against your own body weight, you have to add resistance. That said, if you got 150 or more pounds of body weight, you got a hell of a lot of resistance to work with if you want to.
Yeah, it's interesting how things start with the foundation and the postures and the positions. And I consider myself a pretty high level athlete, Division I, cross country and track and field. And it wasn't until I got well into my 30s as an athlete, or as someone who still competed, where when I found CrossFit, where people started to talk to me about movement, biomechanics and those sorts of things. And that's when the light bulb went off of how important your posture was, how important your movement patterns are. And so to work with athletes now, it's you say, hey, we can fix these things. We just have to teach you how to breathe. And they're like, what are you talking about?
Yeah,
but
agree.
I know many success stories of people doing decompression breathing and fixing some of their spinal issues.
Decompression breathing is one breathing modality that has some success in remedying a lot of like really crappy postural patterns, shoulder patterns, hip patterns. And if you're doing decompression breathing right, you're actually using your legs more than you're using your expansive rib cage. You're anchoring yourself down really intensively and then using a leverage sort of muscles and pulleys against one another. There's other systems out there, dynamic neuromuscular stabilization, which teaches a very powerful abdominal breath and bracing technique. Any weightlifting, by the way, we're not teaching decompression breathing for weightlifting. We're teaching decompression breathing for expansion, for various reasons, for supporting the spine accurately in body weight resistance. But if you were to take that lengthening breath into heavy deadlifting or heavy squatting, it's the wrong breath. You need abdominal tension, a 360-degree, much lower anterior and posterior spinal tension to absorb compressive loads. So there's a lot of different techniques. Yoga breathing is a totally different thing. There's a whole bunch of different styles of breath work taught within yoga. So just to speak to your statement, breathing can be used to remedy a lot of things, and it's probably like the biggest lacking thing in most training. People train their biceps, they train their forearms, they train their calves and their abs and their butts and their everything. But they don't very often, other than running or doing cardio, specifically train the patterns of their breath.
Yeah, and I think even then, there's a very little awareness in terms of the rhythmic pattern of breathing with cardiovascular exercise or running, particularly in terms of inhaling versus exhaling versus, you know, when you're landing versus when you're in the air, those sorts of things. There's a whole, yeah, I mean, it's so extensive, like you said, with the breathing. There's different types of things with yoga, and I think that also highlights it because, you know, a lot of times I find myself, and I'm sure other people, they're inhaling when they're supposed to be exhaling, or vice versa, you know, and it's like, it's a whole, yeah, it seems so elementary and basic to tell someone that we have to work on your breathing, but I mean, it really does. So
Yeah.
much starts there.
Well, that's like the first condescension that people will throw at you is, I know how to breathe. Well, we're not telling you don't know how to breathe. In fact, everybody knows how to breathe. It's an autonomous, it's an involuntary process of keeping you alive for the most part. But knowing how to breathe involuntarily versus having mechanistic control over breathing voluntarily is a very different thing. And for a lot of people, everybody thinks they shallow breathe because of an inhale, but most often it's because they don't exhale very well. They're very passive on the exhale. One of the biggest things we train is during the exhale, how to control airflow out accurately, because it's the airflow out, that exhale is the setup for the absorption of oxygen. And the way your body doesn't work from here to here, it works from here to here to here. It's like a 3-step process, not a 2-step process. You have to set up the elastic potential of breathing with a very good exhale. And that is one of the first things I've taught a lot of folks that don't really breathe very well is take the extra 2 seconds of exhaling every breath for the next 3 breaths. And try it yourself, just even sitting there, just get that extra 2 seconds that you otherwise wouldn't get. And you'll notice that your body almost creates this mild, wakes a kind of a subtle panic that it wants to inhale pretty quickly. And you're playing with neurology is the entire basis of learning any pattern, from dancing to singing to playing music to moving well to an athletic endeavor to a martial art, or whatever it is. It's grabbing on to the forward current of neurology and patterning it repetitiously until the current follows that pattern. And breathing is one of the fastest entry points we have into that adaptive potential.
Is it at the point now that you have dealt with helping people with their breath so much and their posture that you can look at someone on the street and know they're not breathing correctly, or, oh, this needs to be fixed, or, oh, they got a bad lower back?
You know, I think I could offer everybody a little bit of advice, but I'd be a real asshole if I was going around thinking that about everybody. But I think I could help out a little bit.
So what would be, for the general population, just the average person, what would be maybe a couple of those quick pointers that all humans most likely that aren't in the know could benefit from?
So one of the biggest is head position. I'll turn kind of sideways here. Sorry, we're on the road in our rig right now, heading to our new place. So I have literally a tight space to do this within. A lot of people think the back of their head is kind of supposed to be over their neckline. The back of your skull is meant to be behind you a little bit. It's meant to be more or less in line with the shoulder blades. It's called a lordotic curve. It's a reverse C shape at the very base of the neck down to the shoulders. And that's where a lot of people have what's called anterior head carriage. They lose the curvature, their neck straightens. They get all these different terms that a doctor, a chiropractor, a PT, a trainer, one of them will tell them. And it's an extremely easy thing to fix. And the fix is the sternocleidomastoid muscles. I said sternocleidomastoid, SCM. I teach these very frequently. They attach at the sternum, sterno, the clavicle, cleido, and the mastoid process back at the base of the skull. And those 3 points are a triangle, a very lean, long triangle, 2 points to 1 point on each side of the neck that pull the base of the skull up and back. And when that pulls accurately, you feel this pull. Every breath through the nose kind of elevates the sternum subtly, allowing a from bottom to top breath to be a little bit bigger. and an assisted postural breath, because it's literally suspending the front of the rib cage subtly taller with the pull at the clavicle and the sternum. So it's an easy thing to think in your head. Keep your head behind you, literally, and breathe behind you. The vast majority of lung volume occurs behind your front view, your frontal view. Your sense of self tends to be much more forward, all of us. We look at what we see, we feel forward for the most part. But most of the breathing capacities, capabilities, chemical respirations, the really wonderful things of breathing, the platelet generation. Some of the newest science in the world is that platelets, antibodies, can be formed in the lungs, in the pulmonary arteries that oxygenate the body, that oxygenate the blood every breath. So if you're breathing well, you have a capacity to actually improve platelet production. It's a really interesting emerging science. We thought that platelets were produced only in bone marrow. So breathing has so many capacities, but your lung volume is bigger in the back quadrants or zones of the lungs, behind you, in the back of the ribs, by the kidneys, by the shoulder blades. That's where you want to expand and broaden. But you want to make sure you're using the back of your skull, lifting behind you, engaging those sternocleidomastoid muscles, the SCMs, so that in your attempts to expand the back of you, you're not dropping the front of you. You're still staying powerful. Care Bear stare. That's one of my favorite cues to give people, because that's the reaction I get every time. Lionheart, just go for it. It works. It works really well in many ways. So that's the cue. Keep your head held high, but not from the front, from the back. Keep your ribs expanded and big, more in the back than the front. But make sure your head is held high so that you don't drop at your heart. If you do that, you'll feel pretty good.
Eric, mention it in that exercise, and I think that's a big one for everyone, like you said. Is there any other neck decompression exercises that you would recommend?
There's a lot. I mean, honestly, one of the healthiest things you can learn to do really well are handstands and headstands. Also, one of the worst things you can do for your neck are headstands and handstands. So it depends on your discipline in learning them, on if it's going to be good or bad for you. You know, there's all sorts of, there's an iron neck thing that I know some guys that use. And then there's neck bridges like wrestlers and grapplers use. There's biting down. One of the most important ranges of motion for your neck is the jaw, clenching. If you are a mouth breather and your jaws, you just kind of dangle and there's always like a downward weight, your skull, your neck, your jaw, and the musculature under here will literally change position and atrophy and adapt to that lackadaisical position. So in nasal breathing, in fact, both you guys take a powerful breath in through your nose, but don't do it until you touch right here at the base of your jaw, right at the corners of your jaw, right where your neck and jaw meet. Take a big nose breath. You guys feel that little expansion of the muscle right there? That's it. Yeah. That's good posture. Now take a big mouth breath. Nose breath. Feel that tug. Mouth breath. And you'll feel a little bit of, you'll feel a little, but that's very superficial just from the opening of the mouth as opposed to the inhalation and expansion of the rib cage. So one of the cool benefits of nasal breathing, and this isn't my science, this started with, actually it probably started a long time before this Buteyko guy, but there's a respiratory pathologist from Russia, maybe? Anyways, Konstantin Buteyko, and he started this Buteyko breathing method, which is all nasal breathing, and it just really there's a lot of science around the benefits of nasal breathing. My personal belief is that the posture, it really is benefit from them, but there's so many smarter people out there talking about numerous chemical and physiological benefits of really learning to mechanistically nasal breathe more than anything else. So that's another thing people should be looking into if they're wanting to improve their posture and their overall respiratory rate and health.
mentioning the mouth and showing us the difference between nostril breathing and the weight of breathing through your mouth. Is that something where like mewing comes in? You hear people talking about where that could possibly help your neck as well?
Say that again. What's the phrase?
It's called mewing when you take your tongue and you press it up against the roof of your mouth and in your teeth and in that like good posture.
Absolutely. I've never heard that phrase. You taught me something new. That's good. How do you spell that?
I couldn't. You're asking the wrong guy.
Okay, we'll find it. Mewing?
Mewing, yeah. There was a doctor on Joe Rogan who wrote a book about it who went into the detail. Do you know his name, Rich, by any chance? No. I'll email it to your assistant when we get
Was
done.
he a sleep doctor talking about the benefits of it?
Yeah.
Yeah, that makes sense. That makes total sense. So the benefit of it is strengthening the palate, and especially, so you guys can feel it. Put your hand between your chin and this is your hyoid bone, not your Adam's apple, but the bone behind it. It's called the hyoid bone. You have a muscle called your mylohyoid, all right, that kind of connects the tongue and jaw down to the hyoid bone. And you can press the tongue to the top of the mouth or the bottom, and you can feel the various tongue positions that affect that strength and that range of motion of those muscles under there. Those are the muscles that atrophy and become kind of passively shortened, adaptively shortened in that hanging jaw, kind of crummy posture. Mouth breathing is like the generic phrase of just your jaw stays open way too often. It needs to stay shut, and those muscles need to stay toned. That mylohyoid muscle and a bunch of those other ones are really, really, really of value to sleep apnea. Keeping your airways open when you're not conscious of it. Keeping your airway open when you're not conscious of it. That apnea happens much more than people realize. And it's really freaking dangerous. It can be very bad for you, but it's also more of a metabolic hindrance that stops you from creating very good oxygenation while you're sleeping, creating very good detoxification while you're sleeping, and all these different myriad of things. So keeping these muscles strong with mewing, as it turns out, is one of the really good ways to do that. But it's not just the practice. It's doing that while you're moving your whole body. While you're walking, pay attention to breathing, some tongue strengthening and jaw strengthening exercises. Make facial expressions really big and small. That's one of the best neuroplastic things you can do, is to challenge the facial nerves and the pathways of all the different neurology that is required for that. Each of these silly things is like a little, it's not a hack, man. Hack is such a stupid word. It's not a hack. It's tapping into your nature and your biology and allowing certain things that can be practiced to be practiced so that they stay viable for you. That's really all that is.
Yeah, it's all a practice, and it'd be funny to give a client like some face exercises as part of their daily workout, but as I've gotten more kind of, we like to say woo woo over here, it's definitely those sorts of things that I incorporate with clients and athletes is the breathing techniques. And it's interesting you talk about breathing into the back of the lungs, because for athletic performance, we always talk about strengthening the posterior chain in terms of the go muscles, as opposed to the muscles in the front, which are the show muscles. So it's interesting too to know that like you have to be focusing or at least putting your perception into the back of your lungs when you're trying to work on that breathing as well.
Yeah, look, your lungs are a 360-degree expansion, even though they have an they're ovoid, and they have like these different shapes to them and chambers to them. They still expand as a gas expands in all directions. So you have to give them space to do so. I was just thinking about mewing. I'm realizing, I bet these muscles used to be, could you imagine eating like a raw meat animal and you had like a couple hairs stuck in your teeth? How hard your tongue would work to push those out if you didn't have you had no Q-tips, nothing like that, or toothpicks, maybe fingernails, maybe. You probably have really strong jaw muscles from trying to get shit out of your mouth. So that's probably something we're meant to do a little bit.
But yeah, it's interesting. I was going to mention that too. It's almost like, jaw strength and strengthening of your tongue and your jaw is somewhat of a case for a carnivorous lifestyle or diet, because you're probably going to be using more jaw muscles chewing on animal protein as opposed to just plants.
I would imagine. I mean, I would imagine. But then at the same time, they talk about, you want to have really healthy teeth, have a lot of fibrous vegetables to get in between them. Who knows what the answer is on diet stuff, man? I go like this. I say, eat what makes you feel good. And if it doesn't make you feel good, stop eating it. That's the basis I'm learning. Especially, we have one daughter, and then we're newly pregnant with another one. So we're experiencing all the hormonal senses change rapidly, and tastes. The things that she loves, she hates. It's so different. It's a trip. So yeah, you eat what makes you feel good sometimes.
Yeah.
So being a fan of yours and listening to a bunch of podcasts throughout the years and brushing up on some today for this interview, hearing you talk about kind of how the spine and your posture kind of goes hand in hand with your thoughts and how you think and stuff like that. And I know not every day you get to talk to Dr. Eric Goodman. So the question I have for you, because something that we both struggle with, is we have sciatic pain, psoas, hip, kind of in that same area. Do you have any, one, maybe suggestions, kind of exercises for that? And two, maybe, obviously you're not looking at us, but things that we might be doing to avoid because it's so chronic?
So I'm actually doing a live on Thursday, a live for our streaming community called Healing Sciatic Pain with Strength, in which I'm going to do about an hour to an hour and a half lecture and display and routine of how to fix sciatic problems to the best of my ability. One of the things on sciatic pain is it's a compression of the saddle. You're sitting in such a way that compresses the L4, L5, S1 nerve appendages just a little bit for whatever reason. Usually working on the adductor muscles, the inner thigh muscles, leaving alone the IT bands, letting them just lengthen as you work hard on internally rotating the hip joints, freeing up the back edges of the nerve pathways by tightening the front and opening the back. Think of the femurs like a scroll closing inward. We have a lot of exercises that practice that, but the one that I recommend to everybody, because everybody can at least start it, is our internal leg trace. The internal leg trace, if done well, it kind of closes across the midline of the body, and it opens that posterior back edge, the back area of the nerves that affect the sciatic nerve and that become the sciatic nerve. And with a little bit more room, you get a lot less signaling. So we want to strengthen the muscles that close the legs together and rotate the knees towards each other and the toes towards each other. And we want to loosen the muscles that tighten the feet away from each other, like walking duck-footed. The best thing you can think of is when you're driving, put a water bottle between your legs and keep your legs touching the water bottle throughout the drive. That's one of the fastest fixes you can have for sciatic pain. Just keep them touching. They don't have to squeeze. They just have to stay on the bottle. Because it's when they go like this that your sciatica becomes a problem and the compression goes to that nerve area. So you just want to keep engagement to keep you upright and tight on the midline. We have a lot of work that helps sciatica. In fact, if you want to go get a free one on YouTube, I have a video called Helping Patty Out of Pain. Patty is one of my oldest patients, both in the duration I've worked with her and then she's in her 60s and an amazing surfer, an amazing athlete. And beat up, man. She has beat her body to hell. She does a good job of maintaining everything she needs. And that's a freebie that we put out there, Helping Patty Out of Pain, that goes through a few exercise protocols for her sciatica.
And talking about having that bottle between your legs, I'm someone who has bowed legs. So when I walk, would that be something where I almost want to have that imaginary cue in my head when I'm walking to keep everything inward?
Think of your knees. So right now I've got my fingertips are my feet. All right. Right there, right in between is the knee. Make sure your knees aren't facing away from each other when you step. Make sure your knees, like an elbow pulling forward or like a string being pulled forward, make sure your knees are moving and aiming forward, and you should be in a pretty good direction. And your knee is your patella, the very tip top of your patella in the middle, the kneecap. That's what I'm talking about. That needs to aim forward. And all that's going to do is allow your hip sockets to do this. with every step. Turn in just a little bit. And what that does is it eccentrically it provides enough resistance for the iliotibial band, the glute muscles, the hamstring muscles, the posterior chain to fire powerfully. Whereas when those knees are turned away from each other, you're depending on your quadriceps and your IT band in a very different way, because your butt muscles stay tight but not useful. And your quads begin to dominate and your calves begin to dominate. That's not what walking is. So one of the things that you really want to work on is those knees aiming deliberately forward.
Thank you.
And is that something, can you do that without cueing to be pigeon-toed, or is it okay to use that kind of as a point of reference?
You're gonna notice you're not pigeon-toed at all when you do it. You would think you are, because most people are very used to just kind of letting their legs kind of just go when they're walking. But I promise you, if you're doing it accurately, you're not aiming across the midline. You're aiming forward. Your feet will follow forward, not pigeon-toed.
So you want to think about more of making that happen with your knees with your femurs as opposed to your lower legs.
Exactly. Actually, the hip joint itself.
Yep.
You know, where the femur comes into the hip socket is really where you're trying to create this operation.
Okay, awesome. And that water bottle tip for driving, because that's where my sciatic nerve tends to torture me. And I literally back in October, I drove back from New Jersey to Colorado. So I spent 3 days in the car and I was just broke off when I finally got home. And I dread long drives just because of that. So I'm going to have a spare bottle in my car from now on.
It's so easy. It's one of those really simple things that when you start doing it, you're like, well, okay, it's kind of optional if I'm going to be hurting that bad or not. And you start to squeeze a little bit, you start to realize, and your goal is not to turn off sciatica. It's to have the strength and sensitivity to understand why the sciatica would turn on in the first place, to recognize that, and then to turn off the sciatica, and to understand that strengthening pattern, that autonomy, to kind of make it a choice if you're feeling that symptom or not. That's the goal of all of this work, is to have the skill of symptom relief, not just the reactivity of symptom relief. So the water bottle, the walking, each movement you do in foundation training. This is why I recommend people use our baseline protocol, because baseline takes you through each of these steps and takes you through each pose so that you really understand the mechanism of hip centric motion and integrated chains of muscle operating to keep you very lined up and actively aligned, like you're kind of constantly your own chiropractor instead of needing one as often. You need them, but for tune-ups. So the idea is not use this fix with the knees and the water bottle. It's get to a point really, really soon where you're like, well, that makes total sense that he makes us keep the water bottle there and follow the knees. That actually makes total logical sense, somatic sense, body sense in what you're feeling.
Yeah, I can already just sitting here playing around with it a little bit with it. A visible bottle, I can start feeling things firing a little bit differently and picking up on
it's
some
just
things.
different muscles, different support systems. That's all. That's
all
I do for people, is give them different support systems.
And I think it's also giving them something like a perception, something to cue on. I think even for athletes, sometimes they're so, whether it's because of phones and computers and technology and everything, we are so disconnected from just our sensory data. I think just giving people things to focus on or like, oh, I never thought of that. Just giving them different cues to be aware of, and just creating that awareness for people. Just you could see the light bulbs firing left and right.
Yeah, that's the goal. A teacher should see their students and people trying to learn from them actively learning. And that looks like what you just talked about. Like you're going through and you're teaching your body something, and your body is lighting up and learning and feeling as you're teaching it that thing. And repetition is the ultimate teacher with this work.
Might just see another ultra marathon before my career is over after this conversation.
There you go.
I'm excited.
There you go. Yeah, man. If you decide, I hope it helps you get there. And it's helped a lot of people do some crazy stuff. I'm very proud of.
Yeah.
It helps me live a basic athletic life. I enjoy my normal ranges, nothing too crazy. I enjoy playing and having a good time and surfing and climbing or hiking or running or whatever it is. But for the super athletes, I've been fortunate to witness some pretty wild things that it's helped them do. So it's cool.
When it comes to daily practices in my life, I've learned the older I get, it starts as one thing, and then as you do it, you get more and more context. With the foundation training, knowing that you started with your, you just wanted to have a better spine, and 14 years later, 3 books and all the information you're put out, does it have different context, different meaning to you these days? Have you discovered anything new recently?
I've discovered a lot of new stuff recently through our instruction team. So I had an extraordinarily creative 13 years. When the pandemic hit, I went very insular on focusing on our family and kind of correcting some business flaws that we had done over the years, and really trying to streamline what is a small family business in foundation training. So my creative impulses in exercise are still very prevalent, but they're not as focused as they were for the slightly over a decade that it really took me to refine foundation training to what it more or less is today, with subtle evolutions still occurring. Now we have strength programs through Jesse Salas and his talents and skills, and we have first responder programs through him and Evan Halquist, and we're getting pediatric programs through Ali Cost and my wife Jen. So there's different angles that now offer a reason to be a little bit more creative here, a little bit more creative there, but it's much more collaborative than it was initially. I was very stubborn for a lot of years in how this would be taught, how it could be how it can be taught. That's the best way I can put it. How it can be taught. You can't screw up my stuff. I would always give this phrase in every certification I would teach. If anybody's going to screw this up, it's going to be me. Please be respectful of how we teach this and what our guidelines are. We're trying to build something here. Now, I feel that our education team is teaching better than I ever taught. I'm a part of the education team, but I'm a piece of it. I'm one of 7 of us, 8 of us now, sometimes 9 of us. And we have a big community. We got over 1,200 instructors around the world, and that number is growing every few months by 20, 30 instructors. So we want to it's a very creative process, but I started this at 27 and I'm 41. And when I started it, it was, I'm so angry at the profession that hurt me and didn't accept me and it's not about the adjustment. It's about active alignment. And this is what you have to do. And I was kind of almost dogmatic for the first few years. Then I proved myself wrong a whole bunch of times with the breathing stuff and having to take a little bit of extension of the spine out to get a healthier decompression breath. And the way that I learned a lot of those processes was by screwing myself up and hurting myself and having to pull myself out of it, usually for weeks on end. But it was a very cool process. I learned about movement, and my patients that would trust me, we would explore together. And 2009, 10, 11, 12, 13, 14, 15, not as much 16 and 17. I was really voluntarily being extremely transparent with my patients that I wanted to try some things with them once they trusted me a little bit with movement. And the things that would really stick would stick. And I would start then teaching those things in our certification course. And our cert went from 15 or so exercises to now a 25 exercise 2-level certification over 8 years or so. So foundation training was this absolute need for my own back that was dramatic and stressful and somewhat chaotic and frantic until it took a little bit of shape around 2009 and 10. And then it became this thing what am I going to do with this idea? Does anybody even care? has this already been done 100 times before? And I'm just an idiot. I don't see it. I don't know. So I started putting it out there, and you'll see the first YouTube videos in 2011, 2012, 2011, the first foundation book came out. And from 2011 to about 16, I realized, okay, nobody's really done this before. Cool. Then the second foundation training book came out with True to Form. Put out Decompression Breathing. I was like, okay, nobody's really done this before. All right. So now 6-7 years later, I put Foundations of Health out, which is not a biomechanics book like the first two, but it's the evolution of what I've learned over 13, 14 years of teaching this, and having chronic pain patients come to me very often when other people weren't able to help them. And sometimes we could actually crack it a little bit and get in there and make a few changes and make some improvements. And man, I learned a lot, and it changed my viewpoint of what health is, and what pain is, and what perseverance is, and what strength is, and why it matters to translate something for somebody accurately if you're teaching it to them, and not just give it to them. And why it matters to meet somebody at their place, not where you want them to be. Each of these lessons is what foundation training is to me. It's like this constant ongoing life lesson of how to interact in the world in a giving sense, and also how to take lessons as you're doing it, like how to get some shit done and really take your place in this world and do what you are supposed to do.
That's a beautiful thing. All of that. With all that being said, what's in store for you and the team and foundation training, and anything new on the horizon? Are there going to be any clinics coming up in Buena Vista that we might be able to attend?
Something. I mean, yeah, with me living there, I will do stuff there for sure. And I will see patients there in the near future. And my patients are not coming to me to go lay on a table and get adjusted. They're coming to my classes, or they're coming for biomechanics lessons or chronic pain management lessons. We're going to have some real interactions that change how your body interacts with pain. And sometimes that's going for a walk by a river for a couple hours. There's just different things that I've learned over the years. I don't really think I need a clinic. Clinics, like you're saying, are kind of a gathering of people learning something together. So that type of thing will definitely happen out here in Colorado.
Excellent.
But yeah, what's next for Foundation? Nothing's next. We're right where we want to be. Our app is getting really good. Our team is working pretty hard on making that better. And our team is my best friends of the past 20 plus years. A couple chiropractors, ex-firefighter that joined Foundation training full-time, and Jesse, occupational therapist in Allie, and a lawyer/producer in Paul, who's made every video you've ever seen since 2009 or 10, or no, I guess 11. So yeah, that's our crew, and we're just going to keep doing this. And we've got a nice trajectory. We've got a nice flow going right now, and our work is improving as we're getting older and understanding it better. And I'm very proud of how our instructors view us looking inwards. We hear really nice, positive things from that community, and that has us pretty focused on that.
Very cool. I have a small world story for you. One of my former coaches, a mentoree, I hipped him to foundation training, and we would do those sorts of things with our athletes at the high school level, cross country and track and field. Fast forward to pre-pandemic, and he has a freshman that shows up to be a part of the team, and it turns out that the athlete's mother is a foundation instructor, and that's in New Jersey.
That's awesome.
So
that's awesome.
It's out there,
man.
for
small
sure.
World's going on. That whole small world effect is happening on a more frequent basis, and I love hearing those stories. Never ever would have dreamed that teaching an exercise slightly differently, or focusing on a slight different part of the body that just for whatever reason was absent in my education and other people's medical educations would lead to what it led to. It's really cool.
Yeah. And you mentioned, Jesse and the first responders and that sort of stuff. With your instructors, people that are coming to you to become instructors, is it across the board? Like, you have chiropractors, you have personal trainers, strength and conditioning coaches, yogis? Does it run the gamut?
It really does. We have a spectrum. We've had everything from cardiologists and neurologists to firefighters, gardeners. We've had ginger farmers and organic gardeners come and do it for their own education. We've had numerous. We just had a virologist come through, and we got to have this really interesting discussion during our certification in Colorado several months back of how the influence of decompression breathing and lung volume influenced COVID patients that she was dealing with. So it's really interesting. Like, it really does go across the board. We have a lot of Pilates and yoga instructors, a lot of chiropractors, a lot of physical therapists, a couple of osteopaths, a handful of medical doctors, many trainers and strength coaches of different levels. Yeah, people.
Cool. Very cool.
Eric, we got 4 rapid fire questions for you that we asked all our guests. The first one I have for you is, how do you brew your coffee and how do you take your coffee if you're a coffee drinker?
Well, right now I'm drinking water, but I do have coffee with whole cream every morning. So I get whole whipping cream, a really good healthy one. If I can find A2, that seems to be really good, even though whipping cream is all about the fat, not the protein. So it's not quite as important. So I get a grass-fed whipping cream, and I just do a little pour over. Like, I'll put a little thing in my mug and pour, just very simple. Every morning's the same with that. I very often will put creatine in my coffee. I like creatine for mental energy. So if I'm having caffeine, I like to get that glycogen release. So 2 to 5 grams of creatine is something I recommend to a lot of people as you get older. People think of it as like a strength training thing. And it's like, no. The part of your body that uses the most glycogen is right up here in your brain. And creatine frees up glycogen stores. So it's a very healthy supplement. There you go.
That's fascinating.
Yeah.
Well, if you think about it, all those energy drinks have creatine in it.
Yeah.
Do they?
Yeah, a lot of
ones.
them.
That's the other tip. Stop drinking that shit. Drink coffee.
Yeah, we try not to. We try to go for the cold brew.
Yeah. Well, you have, I think it's Laughing Goat. There's a goat farm in BV, so you might be able to score some grass-fed goat milk out there.
Nice. I will look into that. Thank you.
Yeah,
Sweet.
Absolutely. Eric, do you have any daily practices or rituals that you do on a daily basis to show up as your strongest version of yourself?
To show up as my strongest version of myself. The truth is that is just being outside, being in nature. I have to get out in nature in the sun every day. If it's not sunny, I'm out in nature, especially if it's snowing or if it's like really windy or elements are there. I love to feel that. For me, like, honestly, the best version of myself is I have my water before my coffee. I have my coffee, and then I just take my dog for a walk and I start calls and stuff like that. And I'm just in a really good mood because I'm outside. It's nice. I'm with the dog. I'm feeling good. But I don't have, like, people that I know follow very specific morning rituals, and they do a really good job with them. And they seem to help them thrive in a number of ways. I have found that the stress it causes internally for me to try and follow a rigid protocol of any kind, even if I'm the one telling myself to do it, and I like me, and I won't listen. And the stress, and I'm like, oh, fuck you, I want to know. I don't want to. And I have this whole ridiculous. And by the time I have decided whether or not to follow the practice, I've done 4 or 5 other things. So instead, what I do is I just feel good. I know going outside, even if it's shitty out, is going to make me feel good compared to being inside. It's even if it makes me want to come back inside, it's going to make me feel good. In my new house and in my old house, I had my sauna. Sauna is a huge ritual for me every day. It's not something I typically do in the morning, although if that's the rhythm I get into, that's fine. But having a traditional, proper sauna, something I haven't had for a few months, and it's kind of driving me nuts. I've been looking everywhere for them. I go everywhere I can. I'll drive 3 hours for a sauna if I need to. But that is probably the most important mental and physical health ritual that I have. And the one that I don't talk about all that much, but I talk about it in the new book, and I talk about it more openly more and more, is I'm a pot smoker. I don't drink. I don't do anything, but I do really like to have a little bit of pot throughout the day. And I use in a way that I only have it if I'm going to go play and I'm going to go do something well, because I believe it's the world's greatest adaptogen. And I want to adapt towards making good decisions. I don't want to force myself to make them. I want to like a dog getting positive reinforcement. I want to chase things that make me feel good. That's not always joy. That's not always happy. It's satisfied. It's good. Some of the best days I've ever had in my life were in freezing cold outside working on my rig, where I just had to get something done, and then I got it done. I didn't think I was going to be able to, and then I got it done. And I was like, and that hormone flush is better than so many things that we think are good for us. So like the morning ritual or the every day to be my best is kind of like suffer a little bit, you know, find the stress, find the hormesis effect, which is the body's capacity to improve upon small stressors, the ability to handle stress. And, you know, that's kind of my mantra in life, is like, go with it and try to handle the stress as best you can, even in the face of adversity.
Love it. Appreciate your insight and your practice. Have you gotten to any hot springs? You're going to start incorporating that into your practice now that you've got access to those?
I have numerous passes for numerous hot springs in the area.
Right on. Nice.
And have been many times and will continue.
Cool.
My new place is right by one of them, which I'm really excited about.
Awesome.
Yeah.
And I can relate to you too. And you said, I like me too. And sometimes, fuck you, I don't want to listen to me. I have that sometimes too. So I can relate. Eric,
Right?
all the time. What are you listening to right now? Music wise, podcasts, audiobooks? Are you reading anything?
Well, I'm clearly a fan of misinformation. I know that based on what I listen to, who I listen to, the books I read. I like to be misinformed, I have come to find out. So I love Rogan's podcast. I really do. And I've loved Rogan's podcast since like 2009 when he was just screwing around.
Right here,
and
all day.
I like that he challenges people. I like that he says stupid shit. The world is so fragile these days that I almost applaud him for just going deeper into it. So I have a very eclectic Pandora station on that I've been listening to, because I have it on. I've been out of service, so you know, when you're out of service, it kind of plays your stuff, certain stations that you play a lot. So I've had this old country and Brother Ali mix. Brother Ali is an East Coast rapper. Oh, yeah. You guys know.
Oh, yeah.
And then Willie Nelson and Waylon Jennings and all kinds of others. It's a very interesting, good mix. But I think it means I'm in a pretty good mood. So, yeah.
Cool. Well, I actually, the one and only concert I've been to at Red Rocks, I saw Brother Ali there. So we get that. Yeah, it was in the dead of winter too.
Right on. Good for you.
So, and we are huge fans of Rogan, and we are huge fans of misinformation as well. So our final question is,
you know, real quick before that, the other one I listened to that I got into, I love Jon Stewart's new show that he's doing, the podcast that he's doing. If you haven't seen it, it is like, I love that man. I love Jon Stewart. He and Joe Rogan starting a podcast together would be the greatest thing to happen to humankind, if that could happen. Because his is amazing, but it's not nearly as highly viewed or noticed. But those are my two that I've been paying the most attention to lately.
Does he have guest interview? Does he do interviews?
He does. He's got kind of has a discussion panel, like a crew with him, and then he talks about things and he brings people on. It's just kind of new. There's not that many episodes, but if you pay attention to Jon Stewart's new stuff, it's pretty biting and pretty good.
Yeah.
And he's a very intelligent human being who does not want bad people to continue being bad at what they're doing, you know?
Cool. I will check that out. Put that on the queue for tomorrow. And yeah, our final question. It's cool if you do. It's cool if you don't. But I'm saying that you like misinformation. Do you have a favorite conspiracy theory? Maybe not something that you
work. That's an absolutely true one in my opinion, but to some others, man, is that a myth? But I'm a believer.
Right on. That might be the best answer we've had for that question in 150 episodes.
Yeah, that was a good one.
Thank you.
Eric, thank you so much. You've had a huge impact on our lives with the work you've put out, and it really continue to keep on opening our eyes. And thank you for making worrying about your posture and tucking your chin back and all that, making that cool. I appreciate it so much. So thank you.
My pleasure, guys. Thank you so much for having me on here. I appreciate the talk.
Take care. Enjoy the time down at BV. Maybe we'll see you on the river in the summer.
Yeah.
Absolutely. Right on. I look forward to it.
All right. Take care.
Okay. Bye-bye.